Stigma is huge when talking about mental health in the psychology field. It is commonly known that men do not feel as if they can talk about their feelings, yet related to globalization, ethnic minorities face a huge barrier when accessing mental health care. The National Library of Medicine states that racial minorities have more stigmas for common mental disorders when compared with majorities. These limitations include moderate to high risk of bias, high heterogeneity, few studies in most comparisons, and use of non-standardized outcome measures. Many of these ethnic populations live in low socioeconomic areas where they do not find support or prioritize their mental health because they are worried about survival. These people normally end up in these locations due to historical factors, globalization, and societal normities. The world is currently in a mental health crisis. All countries are dealing with how to persevere through it. The National Library of Medicine states, multiple national surveys conducted in the US, South Africa, and other countries have found that experiences of discrimination are associated with an increased odds of developing psychological disorders, including depression, anxiety, psychotic disorders, and substance use disorders. This isn't based off of a certain nation, but is a worldwide problem. People with pre-existing health issues such as HIV, who may not have the treatment to survive, are more at risk with depression and anxiety. In countries that do not have advanced healthcare struggle with treating specific mental disorders, such as schizophrenia. Recent analysts' treatment covered for schizophrenia is to be 9.4 in Ukraine, 19% in the Philippines, and 10% in Ethiopia. Globalization can help with this lack of treatment in such countries due to the migration of technology and advancements. Yet currently these countries are more impacted by climate change, war, or famine, so they cannot worry about a mental health crisis when the stability of their country is at hand. To circle back to the statistics of how countries cannot treat specific disorders such as schizophrenia, this is how we see the inconsistent treatments amongst different countries. Countries that are more advanced can help their population more. We also see inconsistent treatments along advanced countries, with different therapists, states, etc. Some therapists deeply believe medications are necessary while others do not. Psychology is a newer field, so we are still maneuvering through all of that. As you can see in the picture on my slide, even in America, we struggle with accommodating the mental health crisis. Therapists have a demanding job and struggle with burnout at super high rates. Throughout the world, we are struggling to find enough mental health workers to the mental health crisis. Therapists, the HRSA Health Workforce estimates that 23% of U.S. adults have a mental illness and 6 out of 10 psychologists did not accept new patients. And the national average wait time to see a mental health worker is 48 days. I think that we need to figure out how we can benefit from globalization, then struggle as separate countries and separate states and private psychologists from public and yada yada. We need to open up and help therapists so more people want to go into the psychology field instead of letting them deal with their super high burnout rate and let people struggle alone.